Dr. Michael Barnes here, board certified psychiatrist. Today we're going to talk about what I call the psychiatrist dilemma, which is essentially when a patient comes to a psychiatrist already on multiple medications, perhaps 3 or even more meds, and still have active symptoms. The reason this is a dilemma is because there's really only 3 options in those scenarios, none of which are completely ideal. One option is to add another medicine, which could potentially address more symptoms, but the negative is now you're getting caught up in having too many meds, which increases the risks of side effects, and of course the overall complexity of the regimen. Second option, which is what most prescribers end up doing, is increasing the dosages of the medications that are already there. And in many ways, this is the most natural next step when folks are in this predicament. Problem with that option is that if it doesn't work, then you're essentially having the same problems that arise with the first option, where you will just have more and more medicine that can actually be counterproductive. Third option, which is perhaps the most difficult option, but maybe the best long-term approach, which is to actually remove medicine, then replace it with more appropriate ones. This unfortunately creates a scenario where the patient must get worse before they get better. But once the medicines are slowly and carefully removed, you then have a blank slate to treat the patient perhaps even more aggressively than you could when they were on multiple meds. So in many ways, this addition by subtraction, if you will, actually opens up the arsenal of the psychiatrist. So if you ever find yourself on multiple psychiatric medications and still have symptoms that are not resolved, you should probably ask your prescriber if a complete reset is needed.